Well, another great athlete has died this year, Tony Gwynn, great baseball player from the San Diego Padres, and he dies at 54. And unfortunately, that's not unusual. Professional athletes, when you look at them, all sports combined, everything from boxing to baseball, track and field, football, hockey, soccer, you name it, professional athletes don't do well. Their average lifespan, when you take all sports combined, is 62. You separate out football players, professional football players, their average lifespan is 51. Couch potatoes live to be 75. And professional athletes, they get paid to do nothing but be healthy. That's the only thing they're really being paid for, is to stay healthy. Rest, eat right, supplement, listen to their trainers, exercise, do whatever they need to get warmed up before they work out. And yet they have the worst record when it comes to joint injuries. And we're not talking about impact injuries. We're talking about you're just trotting down the field by yourself and you collapse because your knee gives way, your hip gives way, or you get bulging disc, whatever. And so what is going on here? Well, I want you to get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. Get a hold of the book Energy Crisis, which goes into the sports drinks and stuff like that. And it's really a tragedy. Each year in America, when you're looking at amateur athletes, whether it's from grade school, junior high, high school, university, and so forth, just amateur guys, a bowling league Wednesday nights, and the team softball, or the company softball team, and so forth, we don't do very well as athletes. So what's going on here? Well, when you sweat, whether it's from doing your work, physical work, your trade, or your profession, or you're doing athletics, when you sweat, you're not sweating out water, and everybody goes to great pains to drink good water and rehydrate, which is a good thing. But when you sweat, you're not sweating out water. You're sweating out a soup that contains all 90 essential nutrients. If you're taking in that many, if you're only taking in 65, you'll be sweating out 65 nutrients. And then you drink water, or some of these sports drinks, which is gone into in great detail in the book Energy Crisis, and the CD that goes along with it, Energy Crisis. You're going to look at the comparison. I mean, there are just really well-respected energy drinks and sports drinks out there that have 2 nutrients. Some have 6. Our Rebound has 100, which includes 78 minerals. Okay, there's no other sports drink like it. Replaces what you sweat out. Okay? And then, of course, I like the Healthy Bone and Joint Pack because there's so many impact injuries or imploding when it comes to athletes. They don't even get hit, and they're just working out and training, and their joints fall apart, their back falls apart, their muscles tear, tendons, ligaments tear. What's going on? Well, they don't take in enough nutrients to maintain themselves, to maintain and repair themselves. And so this is why you have to supplement. I urge everybody who's doing physical work or certainly working out or participating in sports at some level, at any level, you need to be taking all 90 essential nutrients. I like we have what we call the Healthy Athletic Pack. It's essentially the Healthy Bone and Joint Pack, 1 per 100 pounds of body weight and per month, and also the Rebound sports drink. And we have a great energy drink with lots of nutrients in it called the Pollen Burst, which was the energy drink and the sports drink of the Flying Finns, which were the track and field team from Finland in 1972-76, which they won almost all the events, and the sports writers dubbed them the Flying Finns because they won so many events. And so we have to be thinking in these terms. Why do couch potatoes live longer than professional athletes who get paid to stay healthy? Well, that's because they don't sweat, first of all, and of course, by not sweating, they're not losing whatever little they take in. And so those are things you have to look at. So I urge you to get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Energy Crisis, and compare our energy drinks with the other energy drinks on the market. Compare our sports drink Rebound with other sports drinks on the market. Ours has 100 nutrients. Everybody else's has somewhere between 2 and 6. Now, here it comes. I have so many athletes. Evander Holyfield had a heart attack during a championship boxing match. I'm the guy that rebuilt his heart with the 90 essential nutrients, and he came back and he boxed for 8 more years. Nobody comes back from a near-fatal heart attack and passes all the boxing commission physicals. They can box for 8 more years. Well, he's been on the 90 for Life program. And then we have Theo Ratliff, from the Atlanta Hawks back 14 years ago. The orthopedic surgeon said his career was over because at 28 he had bone-to-bone arthritis in both knees. Cartilage pops off his right hip, catches a pass from a teammate, fractures his wrist. Well, they wouldn't give him his contract back because he was too fragile to play ball. I rebuilt him in 90 days with a healthy bone and joint pack. And guess what? Oh, he played 4 more years and made $140 million in contracts. He retired after his last 3 years with the L.A. Lakers. This guy was an Iron Man after he started taking the nutrients to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes bone itself. Okay? And the same thing is true with Drew Pearson, great football player. Okay, great football player. And he is just doing great on our program. And then we have a bunch of professional soccer players from Arizona, the Steele brothers. Okay, they had what the doctor said was a genetic knee problem. Well, guess what? Just 90 days in our program, they actually opened them up and looked, and gosh, their genetic problem went away because it wasn't really a genetic problem. I urge you to get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Energy Crisis, and the CD that goes along with it, and make sure that your athletes work and perform to their abilities, right? Well, we'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I've got an article here that I got from Fox News. It's headlined, Reasons for Blood Sugar Swings. And, we often on the show get people calling up that are taking the products and still having trouble controlling their blood sugar. They say caffeine, that blood sugar can rise after drinking coffee because of the caffeine in it. And they say sugar-free foods, many foods labeled sugar-free will raise your blood sugar level. And they say they still have plenty of carbs and starches. And Chinese food, they said food that's high in fat can cause your blood sugar to stay high longer. Same is true for pizza, French fries, and other foods that are high in both carbohydrates and fat. A bad cold, they say your blood sugar rises as your body works to fight off an illness. Decongestants used to clear your sinuses can affect your blood sugar. And job stress, they say when you're under stress, your body releases hormones that can cause your blood sugar to rise. Bagels, they say bagels are packed with carbohydrates and calories. They have more carbs than a slice of bread. Sports drinks, they say sports drinks are designed to help you replenish fluids quickly, and some of them contain as much sugar as a soda. And dried fruits, they say be aware that dried fruit will pack more carbohydrates in a smaller serving size. At just 2 tablespoons of raisins, dried cranberries, or dried cherries have the carbs of a small piece of fruit. 3 dates have 15 grams of carbohydrates. Steroids and water pills, they say corticosteroids such as prednisone can cause your blood sugar to rise and may even trigger diabetes in some people. And cold medications, decongestants that contain pseudoephedrine can raise the blood sugar. Cold medicines also sometimes contain sugar and alcohol. Birth control pills contain estrogen that can affect the way your body responds to insulin. And they say you can lower your blood sugar by doing household chores like mowing the lawn or cleaning the house. And they say yogurt contains healthy bacteria and called a probiotic, and it can improve digestion and may also help control your blood sugar. However, they want you to be aware that a lot of yogurts have added fruit and sugar. And a vegan diet, the people with type 2 diabetes who switched to a vegan or entirely vegetable diet had better blood sugar control and needed less insulin. And cinnamon, they say studies have shown that it can improve your body's ability to use insulin and may also lower blood sugar in people with type 2 diabetes. Exercise, they say when you work out, strenuous exercise, it can actually cause your blood sugar to drop for 24 hours afterwards. Alcohol, they say, contain plenty of carbs and will raise your blood sugar as long as 12 hours after drinking. And they say heat. They say heat makes your blood sugar more difficult to control. You should test your blood sugar often and drink plenty of water to avoid dehydration. And medications such as your test strips can be affected by high heat. And hormones. When a woman's hormones change, so do her blood sugar levels. Hormone changes during menopause make it very difficult for them to control their blood sugar. So there you go. Some of the reasons why your blood sugar's spiking.
Yeah, and of course, you pointed out some of the ones that I've been reminding people about, that, one slice of multigrain bread raises your blood sugar higher, quicker, than a heaping tablespoon of table sugar. And people forget that piece. And they say, well, I'm a vegetarian. Well, a vegetarian doesn't mean you're just eating vegetables. It means you're eating lots of grains to get those calories up there because you're going to be hungry otherwise. And I urge everybody to, add the SweetEze to their program. As you point out, SweetEze does have cinnamon in it to help support healthy blood sugar, but it also has a secret sauce. Okay, I can't name it, otherwise it wouldn't be the secret sauce to help you support and promote healthy blood sugar. SweetEze. Okay, oh yeah, don't forget the book Hell's Kitchen. Covers all that. Okay, we'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Ohio, and Teresa, you're on with Dr. Wallach.
Hello, Teresa, you're on the air.
Hi, how are you today?
Fine, thank you. How can we help you?
Okay, I'm dealing with my grandfather. He's got Alzheimer's, dementia, and right now is in the hospital with pneumonia. He went into the nursing home for a couple of weeks for rehab, just for occupational, speech, and physical therapy. In the result of that, he came out. He walked in, but he came out on the stretcher non-responsive because of some things that happened overnight that they did not tend to. So now his
okay. Well, what I would want to ask is, what did they feed him in there? Did they give him the Ensure kind of quick meals where they just pop the top off the can and pour out a cup and say, drink this, and then run on to the next patient? Because those meals are 60% oil.
Mm-hmm.
Okay, and so they're the worst possible thing.
They had plated food that they went to the dining room with. Mm-hmm. I did question about it because he also has diabetes, and I asked him. I said, why do you all give all the patients the same thing, especially if some have diabetes or whatever? Because some of the food on the plate.
And what they say?
They said that they do not specialize in that, and that's why I was really trying to hurry him, get him out of there. But as a result of that, he came out now. His brain wasn't responding because they found him on the floor at 3 a.m. that morning. They put him back in bed instead of calling the hospital. And then they said he wouldn't get up for lunch. For breakfast, he wouldn't get up for lunch. And I said, but he's diabetic. So
I certainly wouldn't take him back there.
Oh, we definitely are not going to take him back there. So
okay, well, quickly, how much does he weigh? How much does your granddad weigh?
I would say probably about 180.
Okay. Well, you need to get him in a place where either you're in control or somebody does what you want to have done, right?
Right.
And so, yeah, he's got dementia, he's got now pneumonia, he's got diabetes, all kinds of stuff going on here. And so, number one, he needs to get rid of all the bad stuff out of his diet, which obviously this place that he was in didn't deal with. No sugar. And that means no fruit juices, no dried fruit, no fresh fruit. He's got minimal carbohydrates, lots of vegetables, eggs. A guy his size, I want him to be eating 8, 10, 12 eggs a day, scrambled in butter, soft poached with soft yolks, soft boiled with soft yolks, just to help support and promote maintenance repair of the brain, particularly the myelin, the white matter of the brain. Then I'd want him to have 2 of the healthy brain and heart packs per month. Absolutely a full dose of each of the products in the healthy brain and heart pack for breakfast and a full dose for everything at dinner time. That'll require 2 healthy brain and heart packs per month. Because he has diabetes, I want him to have 3 SweetEze twice a day, and somebody needs to check his blood sugar. And as it drops, which it will, he needs to, somebody needs to check it and adjust his medication appropriately. And then don't forget to throw in the de-stress capsules, 3 of those 3 times a day to support healthy brain function. And then give us a call every couple of weeks after you get him stabilized, letting us know how he's doing. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Virginia, and Bethany, you're on with Dr. Wallach.
Hello, Bethany, you're on the air.
Hi, Dr. Wallach.
Yes, ma'am.
I have a friend that has bone cancer and has metastasized.
Okay. Well, anytime you have metastatic cancer, stage 4, you're in real trouble. This is a life-threatening situation, obviously. And what they're going to have to do is clean up everything that drives cancer, okay? They got to clean up their life. Absolutely no fried foods. They cannot even be in a house where people are frying foods because the fumes will get them. They cannot have any processed meats or nitrates and nitrites. That means absolutely no deli slices, sandwich meats, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky. All that stuff's got to go. Because, again, the nitrates and nitrites drive cancer and can even, in some cases, initiate cancer. Then they're going to have to give up oils. We're talking about things like coconut oil. We're talking about olive oil, margarines, mayonnaise, salad dressings, cooking oils, no oils. Then absolutely drop dead, no gluten. They need to be able to absorb the good things, and so we need the efficiency of absorption up. So absolutely drop dead, no wheat, bread, or iron oats, and that includes the dog and the cat and the bird and the fish, mother-in-law, spouse, everybody living in the household. They're not gluten-free if anybody in the household is eating gluten because of cross-contamination of the laundry, the couch, the bed, food preparation services, and so on. Then you're going to need, per 100 pounds of body weight, all 90 essential nutrients. Okay, one, say, healthy start pack per 100 pounds of body weight, just to give the body what it needs to support and promote optimal defenses. Your immune system requires these 90 essential nutrients. So one healthy start pack per 100 pounds of body weight. Then I want them also to have a minimum of 3 of our ultimate selenium twice a day per 100 pounds of body weight. Selenium is just a great support of the immune system. There's great variations in the immune system everywhere from auric points to supporting the antioxidant procedures and so on, and the various functions of the immune system. So a minimum of 3 of our ultimate selenium twice a day per 100 pounds of body weight to support the immune system. Then I would also throw in what we call Z-radical. Z-radical is a liquid. It has a blend of super juices, again, to support the immune system. And then it has what's called fucoidan in there. And fucoidan is this stuff you find in a red marine algae that comes from the east coast, off the island of Tasmania, which is off the southeast coast of Australia. And need to do all this stuff, okay? And then call us as this thing goes along here. It's going to be his best shot to support and promote the immune system, his best friend. Okay, well, stick with us. We'll be back with more Truth, Justice, and the Youngevity Way after these messages.
Let's head to Oklahoma, and James, you're on with Dr. Wallach.
Hello, James, you're on the air.
Dr. Wallach, yes, thank you. I am using some of your products like Ultimate Selenium and Ultimate EFA, the SweetEze, and Ultimate...
How can we help you?
The thing that I'm not able to do is I have this super sensitivity to sugars of most kinds, especially like fructose, and that it prevents me from using the Beyond Tangy Tangerine and the Osteo FX. I'm wondering if you have any advice, because I'd like to be able to take those. I think I'd be doing much better if I could.
Okay, well, one of the things you could do is try taking those, but then taking a little extra something else that would help you maintain and support a healthy blood sugar. Shar, what would you tell James to add to his program if he wants to use the Beyond Tangerine and he gets some kind of reaction from the natural fruit sugars that's in the Beyond Tangerine? Not much in there, but there is a little. And what would you add to his program to help him support a healthy blood sugar level?
SweetEze, more SweetEze.
Well, that was a quick, correct answer. Absolutely, very good. Yeah, that's what we would do. How much do you weigh, James?
About 137 right now.
Yeah, 137. I'd go ahead and take 3 of those SweetEze twice a day, be 2 bottles a month, add that to your program, and really watch the carbs. You know, things like even gluten-free bread has calories in it, carbohydrate calories. So gluten-free doesn't mean that you're not going to get some bad stuff. Gluten-free means no gluten, but if you're sensitive to sugar, just remember, one slice of multigrain bread, even the gluten-free breads, will raise your blood sugar faster and higher than a heaping tablespoon of sucrose, table sugar. And so you have to consider that kind of stuff too. And it's better to take in the nutrients with a little bit of sugar in it than it is to have those breads and potatoes and stuff like that. And so you want to be eating lots of celery and tomatoes, and you want to be eating lots of things like the various green stuff, various different types of lettuces and cucumbers and beans and so on. Much better than breads and pastas and so forth. We like to think of those things as being healthful because they're low in fat, but low fat is not good. High carbohydrates is not good. And Shar, do you fatten cattle, Shar, with butter and cream or grains?
With grain.
Well, there you go. And so that's one of the reasons why America is so fat, because people gave us a lot of bad advice, particularly the government and doctors gave us bad advice that eat more whole grains and stay away from the fat. It was a huge mistake because it drove us over the top for obesity. It drove us over the edge for diabetes. And those two diseases are pretty much killing America and driving our medical budget up, and 85% of all bankruptcies in America are due to medical cost. And so it's much better that you avoid whole grains. It's much better that you avoid breads and pasta, even the gluten-free ones, because they do drive your blood sugar up. Okay, so you got to watch all that stuff. Okay, Doug, let's go to callers.
Let's head to Texas. And Birdie, you're on with Dr. Wallach.
Birdie, you're on the air.
Hello.
Hi, how can we help you?
I'm 64 years old, 5'1", 132 pounds, and I bought the Ultimate Classic, the EFA, and the Glucose Gel because I've been diagnosed with autoimmune disease of the ear and tinnitus in April this year. So I started taking this about 3 weeks ago when I found you, and I love to hear you every night. Is this what I'm needing to be doing? Is this going to correct my buzzing that, it goes away for 2 days, sometimes 3, and then it'll come back on depending on how I sleep?
Okay, let's stop. We only have a few minutes here, dear. So, let's see, 132 pounds. Do you have any history of skin problems, any eczema, dermatitis, or psoriasis?
No.
Do you have any history of asthma or bronchitis?
No.
Okay, good. Do you have any history of bowel problems, any constipation, diarrhea?
No.
Okay, good. All right. Shar, here's a lady, 132 pounds, 5'1", so she's overweight by about, I'd say, 30 pounds. Okay. Also, tinnitus. What's tinnitus? The ringing in the ears. What's that caused by, Shar?
It's caused by a lack of calcium and glucogel.
Yeah, actually, it's osteoporosis of the skull, as you point out. Osteoporosis of the skull. And when you have osteoporosis, Birdie, your bones get bigger, and the tunnels that the nerves come through, in your case, the auditory branch of the eighth cranial nerve is being squeezed by the extra bone and bone matrix that happens when you have osteoporosis of the skull. And this is a thing through support and promotion of maintenance repair of your skull, your bones, cartilage, ligaments, tendons, so forth. You can reverse this, okay? You got to support and promote maintenance repair. And what would you put down in her ear? What would you put down in her ear every day, Shar, to reduce the swelling and inflammation around the root of the eighth cranial nerve?
I put the CM cream in there, and eventually it'll go away on its own, but you got to put the CM cream in there for a while for temporary relief.
Absolutely. You want to put, I'd put a quarter of a teaspoon to half a teaspoon down in each ear when you wake up in the morning, again at 11 and again at 3, maybe an hour before you go to bed. And with a Q-tip, like you're trying to get wax out of your ear, as Shar suggests, and that's going to reduce the inflammation surrounding the roots of that, actually the auditory branch of the eighth cranial nerve. And as you notice, you're going to get some temporary relief for sometimes a couple of days, a week, and then it'll pop back depending on what you're doing, what you're not doing in your diet. And so stay away from all the bad stuff, no fried foods, no processed meats, no oils, no gluten. And I would go ahead and at 132 pounds, go ahead and get one healthy bone and joint pack, Shar suggested, per month. Throw in an extra bottle of Osteo, throw in an extra bottle of Glucogel, so you can take an ounce of the Osteo twice a day, 15 Glucogel a day, 5 at breakfast, lunch, and dinner. Don't forget the CM cream. You want to probably get 2-3 bottles of that a month, and you'll be amazed. Stay away from all the bad stuff. Again, the fried foods, the processed meats, the oils, and so forth. But you can get temporary relief very quickly. I've had people with really disruptive tinnitus for 23, 25 years. In 10 minutes, it goes away for the first time, and the relief will last for 3 to 5 hours. It'll slowly creep back until you get, permanent rebuilding. But you're going to have to support and promote maintenance repair seriously, obsessively. Okay, it can't be sort of a little bit of here, a little bit there, part-time, maybe once a week. No, it's got to be obsessive twice a day. And this is going to be forever. And you got to stay off of gluten forever so you can maximize your absorption of the nutrients. Call us every couple of weeks if you would, Bertie, and let us know how it's going. But if you want to, you can throw in the ASAP, a full dropper full under your tongue 30 minutes before each meal. Absorb it through your oral tissues, and that'll help you with your weight concerns. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 for Life Crusade. And Doug, let's go to callers.
All right, let's head to New Jersey. And John, you're on with Dr. Wallach.
John, you're on the air.
Good afternoon, Dr. Wallach.
Yes, sir.
I've been diagnosed with number 4, stomach cancer.
Okay, I'm missing that.
All my lymph system.
Okay, okay. Wait a minute. You're talking about stage 4 lymphatic cancer.
Stomach cancer.
Stage 4 lymphatic cancer.
And it was spread all over my lymph system.
Okay.
And I've called up, your store, and I got email. I bought 5 different products.
Mm-hmm.
Healthy Body Start Pack, Ultimate Selenium, Oxybody, Zradical, how you call this? Cell Shield.
Oh, Cell Shield RTQ. Mm-hmm.
And I would like to ask you whether this is enough for my case.
Okay. Well, first of all, how much do you weigh? How much do you weigh, John?
I weighed before 190. Now I'm weighing 148.
Okay.
I dropped like a rocket.
Yep. Okay. Yeah. When you have stage 4 cancer of any kind, you have a serious life-threatening situation here. There's no doubt about it. Okay. You can tell by extreme loss of weight very shortly, very quickly. Your body's fighting, literally fighting for its life. And your best friend in this case is going to be your immune system. And you have to do two things to help your immune system. Number one, you must stop the ongoing damage. Okay? And Shar, what would you have John give up in his diet? What would you have him give up in his diet to stop ongoing damage?
He needs to give up all carbohydrates and all gluten.
Okay, and what about the 4 bad food groups?
Yeah, no burnt animal fat, no margarine, no salad oils, none of that stuff.
Okay, what about processed meats?
No processed meats because they got nitrates and nitrates that cause cancer.
And drive cancer, exactly right. And so, no fried foods. I don't care if it's organic, vegetables, and stir-fried with extra virgin olive oil. No fried foods whatsoever. Absolutely no deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky. Absolutely no oils. It means absolutely no olive oil, coconut oil, margarine, mayonnaise, salad dressing, cooking oil, as Shar said. And then absolutely no gluten, again, as Shar said, because you want to maximize the absorption of the good stuff and increase the absorption efficiency, okay? So that means no wheat, no barley, no rye, no oats. Okay, there is no such thing as gluten-free oats. The gluten in oats is called gliadin, and so you can play a word game here. There's no gluten in oats, but the gluten in oats is called gliadin. So if you can get a gliadin-free, gluten-free oats, go for it, but there are no such things, okay? Then 148 pounds, you're exactly doing everything, but just make sure you're taking 3 servings a day. You're going to get 1 shot at this to support your immune system, which is your best friend here. And so I'd take 3 doses a day of each of the things you're doing. I would throw one more thing in, and that would be the Ocean's Gold for the sea cucumber. I'd also take 3 of the Ocean's Gold tablets in addition to everything else you're taking. I would throw in 3 of the Ocean's Gold tablets at breakfast, 3 at lunch, 3 at dinner. That'll be 3 bottles a month, again, for the sea cucumber. And you can Google sea cucumber cancer treatments. You'll be amazed at what you see. It was a huge article in the Wall Street Journal a couple of years ago, and we really tripped onto it at that point because we already had a great product with sea cucumber in it. So again, it's designed to support and promote your immune system. And everything you do, stop the ongoing damage with the dietary changes. And this will be for the rest of your life. Have the doctors given you any sense as to what's going on here? Because oftentimes you get to be stage 4, they'll say, you got 3 months to live, you got less than a year to live. Have they said anything like that to you?
Well, he told me 2 months.
Okay. How long ago was that?
A month ago.
Okay, well, I wouldn't take any more chemotherapy because it might kill you in 3 days. Give us a shot. The odds are we'll beat that. Keep in touch with us every couple of weeks. Thank you, Shar. Super job. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.